Hi my dear friends, in this video we will talk about the primary health care, and this is very important for your PG entrance examination point of view. So first it is very important to know what is the primary health care. Primary health care की definition first. So primary health care, first let's suppose this is the village, and in the village this is the individual, and this is primary health center. Now this individual is diseased, is ill, so first this patient will go to this primary health center. Now this primary health center must be easily accessible by the individual. Now as the patient come in the PSC, in the primary health center, now this whatever the treatment which is provided by the primary health center workers, that treatment must be accepted by the individual. And now whatever the treatment which is provided by the PSC to this individual, this treatment must be affordable by this individual. And here in the primary health center, all the essential health care is provided. So what is definition? Primary health care is the essential health care which is made universally accessible to the individuals and universally acceptable to the individuals through their full participation, and at a cost the community and the country can afford. Now friends, after the definition, there are 8 elements or 8 components of the primary health care. So first there is education, and this is very important. So through the education, the primary health care workers educate the people for the common health problems and also educate the people for the methods of preventing and controlling the disease, controlling the health problems. So first the community or the society is educated for the health problems. What are the health problems and how these health problems can be prevented and controlled. After education, proper promotion of food supply and proper nutrition is guided. So through the primary health care, the community and the society is educated with the proper food supply and proper nutrition. What type of food they should take, what type of nutrition they should take to avoid malnutrition. After food, there must be adequate food. After food, the adequate supply of safe water and basic sanitation. Now community is educated for the benefits of the safe water. How can you make safe water? Safe water means water that is having very less amount of pathogens, and this type of water can be made by boiling the drinking water. So the community is educated that you should take boiling water for the drinking purpose, and people are educated with the health problems that are related to this sanitation. If there is no proper sanitation, there is no basic sanitation, then it may cause health problems in the society. So first educating the people for the common health problems and educating the people for the methods of preventing and controlling the common health problems. Second, there is a proper food supply and proper nutrition. Third, adequate supply of safe water and basic sanitation. Now fourth one is maternal and child health care, including the family planning. So here in the primary health care, both maternal, mother, and child, both are properly monitored. And here in the primary health care, family planning, various methods of family planning are educated for the community. Next is immunization against major infectious diseases. Now here in the primary health care, immunization is done against major infectious diseases. Next is prevention and control of locally endemic diseases. Next is appropriate treatment for the common diseases and common injuries. And last one is provision of essential drugs. Now for these common diseases, common injuries, common illnesses, essential drugs are given. Now next is four major principles of the primary health care. So first one is equitable distribution. It means the primary health care must be shared equally by all people irrespective of their ability to pay, and all must have access to the health services, either the patient or individual is rich or poor or urban or rural. All individuals will get same type of treatment. So first one is equitable distribution. Now next is community participation, and the best example for the community participation is the barefoot doctors. Now here there is a story. Now in the China, this is the China. In the China, there are some villages in which, let's suppose these are farmers, these are the farmers, and some farmers are well trained in the urban health center, and these farmers are well trained in the urban health center, and these farmers are well trained for the are medically as well as paramedically trained, paramedically as well as medically they are trained. And now after getting proper training medically as well as paramedically, now these farmers from the urban health centers again go into the society in the village, and they help the village society, they help the village community. So among the community, some people are selected and they are well trained in the urban health center, and they again go in the society to help the individuals. And now these farmers which are well trained medically as well as paramedically, and these farmers are individuals among the society, so these farmers must be showing their interest towards the health care. That is why these farmers should participate for the development of the health care, and these farmers are called as barefoot doctors. So first there is equitable distribution, second one is community participation, third one is intersectoral coordination. Only the primary health care is not sufficient for the proper treatment, proper development of the health care system in India. Some intersectors must be involved, like agriculture. Proper agriculture is essential for the provision of, if agriculture system is very proper, very good, then sufficient and qualityful agricultural products will be provided to the society. Animal husbandry, food industry, education, housing, public works, communication and other sectors. So these sectors should be involved for the proper provision of the healthcare system in India. After intersectoral coordination, there is last one is appropriate technology. There must be appropriate technology. What is the meaning of appropriate technology? Appropriate technology means whatever the technology that is used on the patient in the primary health center, this technology must be scientifically sound, this must be adaptable to the local needs, and these technology must be acceptable by the individuals on which these technologies are used, and these technologies must be maintained by the people themselves in keeping with the principle of self-reliance with the resources of the community and country can afford. It means these technologies must be in such a way that these technologies can be handled by the individuals itself, by the community individuals, or patient itself. Now next is 4A's hallmarks of the primary health care. So what are these 4A hallmarks of the primary health care? First one is this primary health care must be easily accessible. As I have defined the meaning of easily accessible in the definition, all the health facilities must be available at the time when the patient reach at the primary health center. All the treatments which are applied on the patient, which are used for the proper treatment of the patient, it should be acceptable by the individual, by the community, by the patient. and whatever the treatment which are given by the PSC to the patient, it should be affordable. So the CVCF, CVCF, CVCF. So from this C it is accessible, from this V it is availability, from this this C it is accepted, and from this F it is affordable. And my dear friends, for the principles of the primary health care, the mnemonic is for this four principle is AICES. So from this A it is appropriate technology, it should have appropriate technology. From this I it is intersectoral coordination, from this C it is community participation, from this E it is equitable distribution. So these are the four major principles of the primary health care in India. So friends, this is all about the primary health care. I hope this video will be very helpful for you in understanding properly the primary health care. And if you really gained something from this video, then please share this video as much as possible to your needy friends. And in the last, thanks for watching this video, and I wish you all the best for your bright future.